Hello, my name is Patryk. I'm from Micro Solutions, and I'd like to talk to you about software as an integral part of the near future medical sector. Aren't we already in technology and software dominated healthcare? Well, when you go to a doctor, you might get welcomed by a receptionist who will take your name, ID number, and other personal data to enter it into some patient management software or HIS. Then you meet with the MD, who will ask you questions, examine you, and most likely enter his or her findings, the data, into the same system the receptionist used. You might get examined with state-of-the-art equipment that relies on image analysis, machine learning, and other automation software and hardware. Maybe you'll need to examine your blood or tissue, opening the door for more technology that will do the analysis and guide a lab technologist through the process, starting with sample collection and ending with a detailed report. Then you go home, log in into a web portal, and access your medical exam results. Looking from this perspective, you might conclude that software already is an integral part of the medical sector. But as there are advances in laboratory and medical software and hardware, the world is full of labs and private medical practices. Who knows, maybe hospitals and clinics too, that entirely or to a large extent rely on pen and paper or Excel to keep their records. From the perspective of such organizations, IT advancements are yet to be seen in their workplace and are certainly not an integral part of their daily routine. How can this be? It is important to realize that technology has no agenda, not even in healthcare. Advancements in any field and their adoption by us, humans, are driven by human nature. Whether 100 years ago or today, human nature remains the same. Our drive for achievement, our errors, doubts, curiosity, desires, greed, aptitude for risk, compassion, empathy, and thus the world will continue to be divided between those who have and those who have not. Access to education, access to technology, access to capital, access to opportunities. And how we will approach technology development may also be divided. Humans are naturally risk averse. When it comes to health and safety critical systems, being risk averse is a very good thing. This risk aversion can be seen as the direction and pace at which technology is being introduced into healthcare. In the age of artificial intelligence, AI is the magical solution to you name it. But modern AI is a black box. Yet the current trend is to develop AI-packed software to support the medical decision-making processes. In April of 2021, the European Commission proposed new rules and actions for excellence and trust in artificial intelligence. Citing the Commission, the new rules will be applied directly in the same way across all member states based on a future-proof definition of AI. They follow a risk-based approach. New definitions and new rules will be created and implemented, but the reality is that laws and regulations usually stay behind technology advancements. Nevertheless, it is a step forward and toward a safer, more trustworthy, and explainable software, be it in healthcare, automotive, environment, or any other industry. Looking into the future, it is without a doubt that technology will permeate healthcare. On one hand, we want to trust the technology. On the other, we make it so complex, it is difficult to do so. It's a complicated issue at best. In this pursuit of handing over human-performed tasks to technology, is more complex always better? At Micro Solutions, we've been dealing with a vast diversity of projects over the past 13 years. We have designed and developed LIMS systems for clinical, diagnostic, and research labs. We have analyzed multispectral, X-ray, light, and confocal microscopy images. We utilize machine learning and other AI techniques to analyze data. We also helped others connect systems and devices over many different protocols like HL7, ASTM, POCT18, or LIS282. And we worked hard to be ISO 13485 certified. Having this broad experience allowed us to encounter unique projects. From our perspective, more complex is not always better. Let me give you an example. A client of ours developed a device to automatically quality test endoscopes. There was a tube, a light source, and a camera that captured images. Our software did the analysis, giving us the result, ratio, how much light is transmitted through fiber, and fiber quality, the number of working fibers. But there was a mechanical problem with the device, which caused halo. Now, you can work on the hardware to correct that, which is quite costly, or you can do some clever but simple software modifications that don't require the use of advanced algorithms. And so we determined the ROI, the region of interest, using a combination of basic image processing algorithms, and once we had that, we just needed to perform simple image segmentation. It's not to say that we have not encountered challenges where simple methods would simply not do. We are involved in projects requiring advanced image processing, utilizing Tensor Flow, UNet convolutional networks, DNN classification modules, and the like to extract information from CT scans, electron microscopes, laser diffraction images, and many more. Things like automatically classifying bacteria colonies, interpreting Sanger sequencing data, or imaging of live cells require the magical approach, but with a high level of trustworthiness. Software has already become an integral part of the medical sector, but there is still much to be done to lower the entry barrier and improve access to safe, trustworthy, and intelligent solutions in healthcare around the globe. And that should be one of the main goals of near future technology. Thank you.